All right, welcome back to the Veterinary Ledger podcast, where numbers meet strategy and every decision moves your practice forward. Each episode breaks down the financial truths, tax strategies, and operational insights that turn good practices into great ones. Little shout out, today's episode is powered by VetPay HCM, the payroll and HR platform built exclusively for veterinary medicine. Simplify your systems, empower your people, and get back to what matters most, your patients. Excited today to have Melissa Walker here on the podcast, co-founder of Sounder Benefits. Melissa, thanks for joining.
Thanks so much, Jared. Super happy to be here.
Absolutely. I know I got firsthand experience of all the guidance, wisdom, and insight you provide practice owners and businesses from the health insurance space. But give us some background, who you are and what is Sounder Benefits?
Yeah, thanks so much. I appreciate that. So I have specifically been in the health and benefits field for over a decade and a half now. I've worked at several different brokerages, carrier side, TPA for self-funded plans. And in my last role, I was leading a health and benefits team across all 50 states before I decided, you know what? I want to do something bigger and better and change healthcare for the better. And so I joined Brian and Sal to form Founder Benefits. We had launched mid 2024. And right now we have just under 100 clients and things are going really well.
So when you say you wanted to change things, what were we looking to change? I mean, I don't know enough about health industry to know like what is changeable.
Yeah, great question. So Megan, in terms of health insurance and healthcare as a whole, it's a number two business expense. After payroll, it's always health and benefits. And it's an expensive cost. It continues to skyrise year after year. It's higher and higher premiums. And so Sounder Benefits, we are not the status quo. We are here to bring significant premium decreases to employers. And it's certainly a different approach in terms of the rest of the industry. So we really guide employers, whether you are a startup and you're just getting going, you're just looking for basic benefits to attract and retain top talent, all the way up to maybe you're a more established veterinarian practice and you're looking to take a more strategic next level approach. And so we guide employers through this entire channel where they're transitioning, they're growing, they're a high growth company, and our impact is significant. So on average, we're seeing anywhere between 20 to 30% in premium savings. And that's without cost shifting. That's without saying, hey, here's a plan with a $5,000 deductible, which it's not attractive. Employees don't want that. They want really great benefits that are affordable. And that's really something that I'm so passionate about, to make healthcare more affordable, and definitely more to come and more is in store for Sounder as we go into 2026.
Yeah, staying on that, like, how do you do it? How do you make it more affordable? Because obviously, it's been a while, but definitely over the handful of years, you had private equity inject itself into veterinary medicine, and they bring with them the Cadillac plan of benefits. So that private practitioner really had to step up and make sure their benefits, the package was industry standard. But like, is there a norm? Is there an expectation of what is it going to cost per employee or per practice owner for good, solid health insurance coverage?
Yeah, that's a great question. I think also, with Sounder, we're not about cookie cutter, off the shelf type of approach. We look to really understand what are your core practice goals and values, and what are your objectives as a business owner. And then we craft solutions that are tailored around their entire approach, their culture, their performance. But we also have shared goals in this process. The shared goals meaning affordable solutions, innovation. Innovation is one specific area where, typically small business owners, they know that there's innovation in the 1,000 plus employee space. And so how am I going to bring that down market and get really attractive benefits when I'm competing against PE and huge organizations? And so that's something that we also handle on. We have different product solutions, and we bring that innovation down market and match it based upon what that business goal, what that business owner's goals and solutions, what that looks like. I think a big thing too, and Jared, you had asked, like, how are you doing this? So we have a fundamentally different approach, and we bring together a combined over 45 years of healthcare experience. Myself being in the industry for over a decade and a half, and my other co-founder CEO, who has worked at Premier, Blue Cross Blue Shield. He has handled Starbucks, McDonald's, Microsoft. And so we're taking all the knowledge that we know in the industry and doing it better. And so our fundamental different approach, part of that is what we have built already since launching Sounder. We have built this proprietary technology solution. No other broker has access to this. We have built it. We're not licensing it out at this point. And what it basically does is after we confirm what that business owner is looking to achieve when it comes to benefits, we then go to market. We use our expert knowledge, but we use our proprietary technology tool to quickly optimize benefit solutions. So I think it's easier for me to kind of dive into a real example with a client that we worked with. They were I would say around 70 employees. They were up for renewal, and they didn't receive their renewal increase yet. We said, send us your data. Let us take a look. After looking at their data, we saw that their specific carrier was offering them over 12,000 renewal options, 12,000 different plans. And so the question is, one, how do you know your broker doesn't have misaligned incentives, right? Sounder, we don't subscribe to that. But two, how do you know, how is your broker handling going through all of those solutions? Why are they picking the plans that they're selecting and bringing that forward?
Sure.
So our technology basically gets rid of that, and it quickly optimizes out of those 12,000 plans. What are the best plans that are going to achieve the highest return on investment and highest value for that employer? And so that outcome is really where we come in. And for this specific case, we took a look at their data. We're very data driven, and it ended up that we told them, you're looking at a 25% rate increase. How do you know that? It's not magic. We're looking at the data. And so they were very much like, let us go through this renewal process, right? Let us speak with our current advisor. And they ended up coming back to us and they said, you were right. It was 25%. We were correct down to the penny. And so now we're talking about predictive analytics, being able to help business owners understand their cost, cash flow, et cetera.
Sure.
So by partnering with them on a bigger level, it really allows us to not only make a fundamentally different, but also being able to bring in those affordable solutions down market.
Huge. That's huge.
And you say we're asking the clients questions. We're trying to figure out what they're looking for. What kind of questions are we asking to figure out? Is it affordability? Is it size of the team? Like what information do you need to make these decisions?
Yeah, that's a really great question, Megan. So we know just from what's out there, right? The Kaiser Family Foundation, really powerful tool to follow. We know the average cost for a family in the United States is over $25,000 per family. That's really high healthcare expenses, right? That's the average. And so we know that going into these conversations, affordability is always number one. How can you find me a solution that's affordable for me as a business owner, but also affordable for the employees? But the other type of questions that are just as important, are you growing? Are you a high growth company? What does your internal processes and procedures look like? What does your culture look like? Do you have a lot of turnover? Or do you have employees that have been there long term? Why have they been there long term? I think all of these things, and in also really understanding employee engagement at a higher level, all of this goes into strategizing a solution that works best for not just the company, but also for the employees.
That's huge. That's huge. Question I get a lot, and I want you to answer for me for once and for all. We have a benefits plan. The practice owner has a benefits plan, but their associate doc, they're paying 100% for them. Their other doctors are only covering at a 50% rate. Can you be picking and choosing the coverage per employee? Is it per employee class? Help me through. What type of benefits can it be differentiating amongst your employees?
I love this question. So, when it comes to compliance, I am definitely a benefits compliance nerd because I love this stuff. That's one of the reasons why I went into this career. I knew in my heart I couldn't do something where it's the same thing every single day. I want to be challenged and I want to challenge the status quo. And so when it comes to these specific type of questions, we always refer to, well, what is the legislation? What is the law? And so when it comes to managing and also strategizing the employer contribution structure, you want to be aware of local laws, but then also the federal laws. And so when it comes to the contribution structure, you're going to refer to the Department of Labor. And the Department of Labor does allow you to structure different contribution structures. You can get creative. However, you cannot discriminate off of someone's earnings. You can distinguish and define your contribution by, you could say, doctors and managers versus all others. But you couldn't say, like, if someone's making less than 100,000 a year, what is their specific contribution? And so that would be considered discriminatory in nature. All of these things too, they typically do come up on founder benefits. We do an annual compliance audit for all of our clients. It's usually done right after open enrollment when we're going through the audits with the carriers, and then we go through the compliance checklist with our employer, with our clients. And so one of the pieces is anti-discrimination testing. You should be doing this every single year, at least once a year, if not more. And that ties into the Section 125 cafeteria plan, the premium only plan, sometimes called the POP plan. And so that also helps guide the conversation of, is what I have today, what exists today, is this even compliant with all of the regulations?
Interesting. Now, can you keep it tenure based? Whereas if you're with me for year 3, I bump up a tier. Maybe it's 85% coverage. Year 5, it's now 100% coverage. Is that part of that discrimination testing, or is it purely just dollars and cents of like your example, the 100,000 example?
That's a great question. So you can do that. And I have seen that in with multiple clients that we work with, where they say, like, year 1 to 3, for example, your benefit deductions are X dollars for each enrollment here. If you've been with the company long term, maybe your deductions are lower. That's a great way to, one, incentivize your employees to stay with you, to stick on for the long ride. It also helps with attracting top talent, retaining the top talent. So that is something that we see. But when it comes to contribution structures and strategies, this is another area where I think a lot of brokers, they miss the mark on that. They say, like, oh, this is, here's some benchmarking reporting, it's all over the map. It's a personal preference. No, it's not as simple as that. It should be handled on a strategic basis, understanding what's the budget behind this, and then having an actual strategy working session live with the client, which we certainly have done that with clients in the past, where we say, like, okay, what will happen if we adjust the family contribution by X amount of dollars or a percentage? And that, we find, you end up getting a much better result while guiding your client through this process to make sure that, we're ticking all the boxes in terms of the employer and the affordability for the business owner long term, right? You don't want it to become a runaway train. There needs to be a strategy too, where it's not you're setting the renewal and then that's it. You have to think about the future too. what is the future going to hold? Are there going to be increases? What's the average increase for those products and the solutions that you're rolling out as a broker?
Understood. Understood. I'm going to put you on the spot with this next one. It's going to be yes or no. And I'm going to give you a
Okay.
hint. My answer is going to be no. Let me make sure I frame the question right, though, so I lead you up to it. So say the average practice we work with, say the average, not absolute, the average is say 50 employees or less, 50 employees or less. Is there a place for that practice to be using a PEO model, or does it get to be too costly at that level, again, under 50 employees or less?
You know what? Candidly, great question. I would say there is always a time and place for PEOs. However, if you have the right team behind you, supporting you in all avenues, benefits, HR, payroll, accounting, where we're all working together, coordinated as a team, you don't need to be paying the expensive fees that a PEO is offering you. I think the big thing too with a PEO, and when we look at these scenarios where we speak with a prospect and they're considering leaving and transitioning off of the PEO, typically the amount that we can save them is so significant that it's a no-brainer. Why wouldn't you leave the PEO for cost savings and potentially even better benefits than what you have today through the PEO? So while I will say that there is a time and place, I think if you have the right relationship set up, it's a complete way so you can reinvest those premium dollars elsewhere.
I just agree
For anyone
completely with
listening who
you.
might not know, I was going to say, what's a PEO?
Yeah.
A PEO is a professional employer organization. So what that means, it allows the business owner to basically join a larger pool. Typically, in theory is that it's more favorable with rates. That's not always the case. That's another thing too, especially this current season that we're in, this peak season for benefits. We are hearing more and more of, I have to get off of this PEO. My increase was 47% when year 1 and 2 looked incredible. And now all of a sudden, the PEO is not running so hot or the risk isn't going so well. And so, yeah, we certainly do see where, it no longer makes sense for that business owner. I would say though, for small business owners specifically in the under 50 space, they they look at these PEOs as, wow, this is very enticing. This is very I can just set it and forget it and not have to worry about this again. But that's also not strategic. You don't want your benefits to be set it and forget it, right? Because now you could be wasting thousands of dollars. Jared, we had a shared opportunity we were working on together. And after I did their analysis, we were saving them 75% on just the cost alone, just by making a simple move. And, the move alone, that can also come down to, I have to do all this work. There's all these pieces, payroll, 401k, workers' comp, benefits, all of the forms, everything that I'm pulling out of the system. But when you're working with the right partners, the partners are taking that off of your plate. And so you don't have to worry about that transition. Let us guide you through it. Let us walk you through the checklist and make it really easy, one step at a time.
I couldn't agree more with everything that you're saying. I just had to have you, I had to listen to you say it because, again, I think it's preached that it's so simple. Yeah, join the PO. Of course, it's like hands-off model, but like the underlying cost for that practice owner, the margins that they're giving up and having that shared experience where you were able to spotlight that one client, the savings. I mean, that's meaningful dollars to now you can reallocate that to your team, more in your bank account at the end of the day. Its possibilities are endless. So again, everything has its own place. Of course, I think PO serves a purpose, but what we're talking about, I just feel like the individualized relationship that Sounder and other providers bring to the table in like the payroll and the HR and in the 401ks you're mentioning, it's just invaluable to get a team versus the one size fits all.
It is. It absolutely is. And like I'll say again too, because Today, Sounder, do we have clients under the PEO model? We sure do. Is it a good fit for them for now? It is. But is it long-term the best solution? Probably not. And that should be looked at. That needs to be closely examined every year. I think a lot of brokers, the reason why the benefits industry has seen such a poor reputation is because brokers set it, forget it. They sit back, they collect the commission, and they're not providing any value to their client. And that's exact opposite of Sounder.
That's what a valuable asset. I want to be mindful of time, but I want to ask, because the question that I get asked the most is, what percentage is everybody paying? Are we paying 100%? Are we paying 50%, 30%, or are we given a lump sum? Like, what are you seeing as coverage from an employer?
Yeah. So this is all across the board. This is a complicated question. This is a yes or no or ABC. The reason why it's complicated is because based on specific goals of that business owner, what they're looking to do. I will say, with that being said, it's very easy to call out the fact that hardly ever now are employers covering 100% of the premium. It doesn't make sense to do so. You could potentially be attracting the wrong type of enrollment too. And most of the time, in certain cases, depending on the size of the group too, when it is covered 100%, now you're seeing this adverse selection type of scenario where if you're a larger group, you're looking at it like, why are my claims out of control? It's because all of the families are coming onto the plan and they're maximizing that coverage. They're using up their benefits. And so that certainly is a factor. But then you also come across companies where they're very dedicated. They understand the costs of healthcare, and regardless, they're going to figure it out and make it work to cover 100% of the premium. So it is all across the board, I will say. Normally, for smaller business owners, we like to help them in terms of, what's the 5-year plan? Let's figure out the first year when you're opening your practice, what would be considered a competitive level. Depends on the rates too. It's not always like a clear percentage across all of the enrollment tiers, right? But then in addition to that, we normally see a lot of companies where if they're just getting going, they might contribute a flat amount or percentage towards the employee only. And then if you wish to enroll spouses, children, full family, they have to pay the difference. We see that a lot. For more established companies, that's where you start to see a higher contribution structure, 75%, 85%, 95%. But again, I do think that the 100%, it's going to be something that we continue to see, where not every business owner will contribute that full 100% contribution.
That's fair.
Makes a lot of sense. Makes a lot of sense. Well, Melissa, thank you very much for the time today and in sharing extremely insightful insight into the health insurance world. How do prospective clients reach out to you? What's the best way to find you and Sounder?
Yeah, LinkedIn. Find me on LinkedIn, Melissa Walker, the Sounder Benefits PM, or just email us, support@sounderbenefits.com. Now is a great time of the year to be analyzing your benefits, and it's not too late. I think, that's the one thing too, when it comes to benefits, a lot of people, they get hesitant to make a change. I have this 10-year relationship with my broker. How am I going to tell them no? But we're seeing that more and more this season, that clients are saying, we told them no because we can't just keep accepting these high rate increases every year. And so that's where we are seeing that shift. But in addition to that, as far as, this being the peak season, yes, we're in mid-November right now. We just had someone say, we want to move forward with Sounder, and we're launching open enrollment next week. So in terms of timing, it's all doable, it's passable, but now is the time to be evaluating.
Love it. Love it. Melissa,
Yeah.
thank you for the time.
Thanks, Jared. Thanks, Megan. Appreciate this, Brian. Have a great weekend.